Okay, for this skill, we're going to do a cap change. So I'm going to say that my line is heparin locked and the cap needs to be changed. Should be changed every 7 days or PRN. So because there's heparin inside there, I want to make sure I withdraw that heparin. If I go and I just flush my tubing, my patient is going to get a bolus of heparin. So of course I would also make sure that I'm dealing with the right patient and explain the procedure to them. So my my line is locked off right now. So I'm going to withdraw that heparin. Okay, so swabbing my port for 30 seconds, and I'm going to attach an empty syringe. And you can attach about a 5 cc syringe, that's fine. We don't want to flush with anything less than 10 cc's, just the pressure is too high. But aspirating back, we can choose a smaller size syringe. So I'm going to aspirate back, and you can see I'm going to get a mixture of heparin, and I'm also going to get a mixture of the patient's blood as well. Okay. So I'm going to clamp when I take that off. Okay. And then I'm also going to make sure that I have my new cap all ready to go. Okay. If I have to put this down, that's fine as well. I didn't have my cap prepared. So I'm going to attach my cap to my normal saline flush. And then I'm going to make sure that it's primed and all the bubbles are removed. Don't want to put any bubbles into my patient's venous system. Now since I put this down, I'm going to re-swab that. Use alcohol swab again. And actually I'm going to swab the whole cap here. I don't really need to use that anymore, do I? So I should really just swab the connection. Okay. Making sure that my line is clamped, because once I take this cap off, I don't want to have any air go into my patient, and I don't want any blood returning. So really important that you have your clamp enabled. Okay. We're going to take off that blue little tip. Okay. And we're going to, if we saw crusties on there, we could also swab that as well after we took the cap off. Okay. There's some discrepancy in the literature. Some literature says get this cap on as soon as you can because you're exposing your patient to the air. However, other literature says, no, you need to swab this connection here. So you're using your nursing discretion. If it looks like there's blood crusty or if it looks, kind of dirty, soiled, then you would swab it and clean it up. Okay. Now I'm ready to put that cap on. So I'm going to screw that on. Notice that my clamp is still on. So what you'll find a lot of nurses will aspirate back a little bit just so they see a little bit of blood return. And then they will continue on and give that line a flush. So using a push pause until the line is cleared. We're going to clamp it and then we can take that off. So now we have a brand new cap on there, nice and clean. We do need to heparinize our port though because it's not valved and we don't want it to clot. So normally you would have to check your facility policy. But usually facility policy is 200 units, so 100 units per ml, so that would be 2 mLs that we would heparinize our line with. Okay. Of course, make sure you double check with your facility policy. Okay. So now my cap is clean. I never did put it down. So if you felt that you contaminated the end, of course, make sure you re-swab it with your alcohol swab. However, I held it in my hand the whole time. So I have my heparin. I would make sure that I verify this with the MAR as well, that I have a 200 unit order for heparin. I'm going to attach that syringe, unclamp, and I'm going to instill that heparin. When I get down to the last 0.5, I want to create some positive pressure. So I'll have the clamp in my hand and I'll also put pressure on my syringe so that I do both at the same time, and hopefully that traps some positive pressure within the tubing so that blood doesn't back up into my line. Okay. And then we can take that off and we would chart. We would document that we gave 200 units of heparin for central line installation.